All right, guys, welcome back to Underground Science. In this video, we'll be talking about Plummer-Vinson syndrome. Okay, so we already talked about this in our previous video on iron deficiency anemia, right? Which we talked a long time, right, about the findings in iron deficiency anemia, and a part of that was the possibility of encountering Plummer-Vinson syndrome. So the only thing that is important to know, right, is that Plummer-Vinson syndrome is a triad, okay, of iron deficiency anemia, esophageal webs, and dysphagia, okay, or trouble swallowing, and atrophic glossitis, okay, which is a smooth, inflamed tongue, okay. That's what inflamed or and red tongue, okay. So that's what atrophic glossitis is, and that's it, right? That's the main triad. So but if we just go a little bit more into this, right? What is the esophageal web that we're talking about? It's basically the your mucosal membrane or your mucosal layer of your esophagus, especially in your upper esophagus, right? So if we say that, let's just differentiate, right? Let's say this is your mucosa, okay, of your esophagus, and then let's say this is your submucosa of your esophagus. And then, of course, we know we have our further layers, right? Like your muscularis externa, right? As we go deeper. And then, but if we just focus on the um, the mucosa and submucosa in Plummer-Vinson syndrome, it's your mucosa that outpouches, okay? So if we get our mucosa in green, that basically, if we just draw it like this, right? That basically outpouches. And if this is in your upper esophagus, you can imagine swallowing food will be difficult, right? Which is what dysphagia is. That's why you find dysphagia. And imagine if food, right, sits around right here, right, and has trouble going down, this can over time, right, irritate your mucosa, right? And this can lead to dysplasia, right? So this may lead to dysplasia later on, right? And we know that dysplasia can progress to carcinoma if not reversed, right? So esophageal webs increase your risk of squamous cell carcinoma, right? Because remember, your esophagus is made up of non-keratinized stratified squamous epithelium, okay? And if we just remember, go over the layers, right? Your mucosa, which is what we're representing in green, is actually made up of three layers. Your epithelium, right? Your squamous epithelium. So, so your squamous epithelium, right? And then your lamina propria, right? Okay, so so these two are the main layers that make up your mucosa, right? And then if you want, we can also include the third layer, muscularis. Remember our muscularis mucosa, right? Muscularis mucosa. Remember this layer is beneath your mucosa or beneath your lamina propria, right? Specifically, it's beneath your lamina propria, and it just helps in the movements of the mucosa, right? So so we should know this too. All right. Now now this is the main layers of the GI tract, right? Of the mucosa of the GI tract. So you'll see your epithelial lining, right? Then your lamina propria, then your muscularis mucosa. Okay. But remember these three layers make up the mucosa of your GI tract. So in terms of the esophagus, it's this mucosa layer, right? It's your mucosa layer, right, of your esophagus that outpouches and then causes and then that's what esophageal webs are, right? It's outpouching the mucosa of your esophagus. Now, of course, we know that below your mucosa we have our submucosa, and then below that we're going to have our muscularis propria, right? Muscularis propria. Okay, so that's important to remember too. But the main thing to know, esophageal webs is the outpouching of the mucosa of your esophagus. Okay, so that's esophageal webs, right? And we said that there's a main triad, which is iron deficiency anemia, which we went over in the last video, right? What labs can you expect in iron deficiency anemia? Remember, low hemoglobin or low hematocrit, right? And then you can expect if you did your iron tests, right? So if you did saw the ferritin levels, that would be low. If you saw your serum iron levels, that would be low. If you saw your TIBC levels, though, that would be high, right? And then if you saw your transferrin saturation, right? Transferrin saturation, that would be low, right? Because you have low serum iron, so there's not much iron to bind to transferrin. Okay, and of course, if you saw your red cell distribution width, that would also be high. And your mean corpuscular volume, since iron deficiency is microcytic, you could expect this to be less than 80 femtoliters. Okay, so those are the main labs to keep in mind when talking about iron deficiency anemia. Okay, so that's basically Plummer-Vinson syndrome. All right. And of course, if you find iron deficiency anemia, you'd want to treat that, right, by giving iron. First treat the cause, then give iron. Okay. And just keep in mind of the other symptoms of iron deficiency anemia too, right? Like fatigue, weakness, pallor, dyspnea on exertion, koilonychia or spoon-shaped nails, pica, the craving to eat dirt, clay, ice, right? Restless legs, and things like that. Okay. Yeah, and that's it. That's Plummer-Vinson syndrome. Hopefully this video wasn't too confusing or anything. Hopefully this video helped a little bit. Thank you guys for watching and see you guys in my future videos.